Well, good afternoon, everyone, and thank you very much for coming along this afternoon. The way this is going to work, I've got with me this afternoon Dr. Alex Allinson, the Minister for Education, Sport and Culture, and also Dr. Gregor Peden, who's been running the 111 COVID line. I'm going to ask Gregor to speak first and just give you an update on the 111 COVID line. Gregor unfortunately can't stay for questions because he's got to get back to the line for the peak period, which is around about 4:30. Then I'll give you an update on testing, and then I'll ask Dr. Allinson to come in and speak about key workers and what's been going on within the educational setting. So if I can invite Gregor up first, please, just to update us on the 111 COVID line.
So the 111 COVID line has been up and running since Friday of last week. I'm humbled by everyone that's been involved in that so far. We've taken, or we expect to have taken, by around 2,000 calls by close of lines today. 50% of those calls at the moment are seeking clarity around isolation rules. Just to help us to help you a bit more efficiently, if I could ask that you make your first port of call gov.im/coronavirus. All of the information and guidance around isolation rules is online. If you do then need to call 111, the website will direct you to do so. That will just help us to help you a bit more efficiently. One of the common themes that's coming through, one of the common call types, are members of the public calling for results of swabs that have been taken. Under normal circumstances, it's obviously entirely reasonable for you to call for results. At the moment, because of the situation we're in and because of the number of calls that we're receiving, we'd ask you not to call 111 or Nobles or your GP for results. We will give you your results. We're obviously having to focus, first of all, on the known positive results and all of the contact tracing that goes around that. Those results that are negative may take a little bit longer to filter through, but we will be in touch with you to give you those results. But can I reassure you that it doesn't really matter what the result is? The purpose of the test is not really for you as an individual. It's to help us in health to predict the likely demand that's going to land on Nobles Hospital. So regardless of whether the test result comes back as positive or negative, for you as an individual, the guidance remains that you stay isolated for the full 14 days. Okay.
Thank you very much, Gregor. Before I update on the testing, I just want to get a message out in relation to community pharmacy. Unfortunately, over the last few days, we have seen an increasing level of abuse towards our community pharmacy teams. People wanting to stockpile medication, wanting increased volumes of medication. There is no need. Quite frankly, there is no need for anyone to be stockpiling medicine or taking more than they normally are. Equally, there is very good reasons as to why certain items are being restricted, such as having 1 pack of paracetamol, etc. And also people should only be asking for delivery of medicine if there is no one available to assist them. But can I please ask that people respect all of our health and social care professionals during this difficult time. They are working hard to help you at the end of the day, and abuse will not be tolerated. In relation to testing, we now have 13 confirmed cases. In relation to all of those cases, they are all self-isolating with what would be described as being mild cases. None of them are being treated at Nobles or require hospital treatment. Just to give you some more detail, in total we've had 186 tests back now, and we're awaiting results from a further 218 tests, and we've got another 42 tests being sent away today. Test results are still on average taking about 72 hours to come back. And again, I'd like to emphasise the message that Gregor's just put out there, that people should not be chasing the test results. We will be in touch with people when those test results come back. I need to say as well that this is in line with what we expected from the very beginning. And what it does is it shows that the community testing is working. We're being able to identify cases out there in the community and break the chain of infection via back tracing. But again, it reinforces the message that we keep putting out there that people need to respect the rules around self-isolation and social distancing. It is only by doing that that we will actually manage to tackle this virus and its spread of it on Ireland. So it is absolutely crucial, and I cannot emphasise again enough that people do not abuse that. They actually follow the rules. They are there for a very, very good reason, to protect all of us in our Ireland community. And I'd also like to take the opportunity to once again thank all of the professionals out there across health and social care for all they are doing in this difficult time. And again, can I please ask that people respect our health professionals who are working hard in the community to protect them. And with that, I'll hand over to Dr. Allinson.
Thank you. Thank you, Minister. Good afternoon. Usually Monday is the start of just another school week with pupils looking forward to Easter holidays. This week's different. This week, because of the fear for the health of our teaching staff, and most of all our pupils, the schools will be closed from 3:30 today. The government, on the best medical advice, has asked parents to keep their children at home wherever possible, and our schools to remain open only for those children who are designated as vulnerable or are the children of key workers. It's very important for parents to understand that if it is possible for their children to stay at home, then they should. Parents and carers should also do all they can to ensure children are not mixing socially in a way that could spread the virus. They should observe the same social distancing principles as adults. Many parents who are key workers may be able to ensure their child is kept at home. Every child who can be safely kept at home should be. The fewer children making the journey to school and the fewer children in educational settings, that makes the risk of spread of the virus lower and means that those vulnerable adults in our society are actually kept safer. Parents can choose to keep children away from school without any concern for repercussions, but we trust parents to make the right decision for their family and for their children. Although schools have closed, secondary and primary schools with special educational needs units attached have been asked to stay open with staff to look after our most vulnerable children and the children of key workers. The Cabinet Office have drawn up a list of those key workers and who they are. These include those who work in health and social care, education and childcare, key public services, local and national government, food and other necessary goods, those involved in public safety and national security, those essential for transport, and those essential for keeping our utilities, communications and financial services going. The list is on the government website, and I'd ask for parents to look at that, but if they're in any way in doubt, please have a talk to your teachers about your needs, and we will work with you. This is a difficult period for everyone, for the staff, but also especially for the parents, and especially for those children who are worried. We will make mistakes, we will get things wrong, but we need to work with you to get this right and get us all through this very testing time for all of us. We trust parents to make the right decision, and we respect your decisions about how you look after your children. But we also know the number of children who are worried, not only about their health now, but also about their future. We've been working very closely with the various exam boards that we use to ensure that what happens today does not affect a child's future in terms of education. And we've also been working with the University College Isle of Man in terms of their students to allow them to continue with their studies. But we also have university students across who are coming back. We need to use those as a resource. I've already been contacted by various students at UCM who are doing the healthcare assistant course, volunteering to go to our hospitals, volunteering to help out at this time of need. And I hope that some of our returning students can bring their skills with them to help us out as a country. I'd also like to talk to those students who may be still in the United Kingdom wondering whether they should stay or come home. It's a difficult decision for you, but if you want to come home, make that decision now. We need you to be safe. We're working quite closely with the child daycare providers and childminders, again looking at the needs of our key workers. We need to work together at this time. We need to come together but stay separate. But if there are any parents who have got any doubts, please ask us. Now is a time for honesty and communication so we can all get through this together. Thank you.
Thank you very much, Alex. And we'll move to questions. Tim, you want to go first?
We spoke to somebody who's contracted COVID-19, the young lady in Laxey. She's describing symptoms that are different to the advice that we've had out. She said she had a headache the day before, then a sort of phlegmier cough rather than the dry cough that we've heard about. So is it developing? I mean, why are the symptoms different?
It's exactly the same as any other virus, same with winter influenza. It affects different people in different ways. The two most common factors, which is how it's assessed, is the fever and the cough, the continuous cough. But that isn't the same for everyone. That's no different from any other virus. That if everyone's body is unique and everyone reacts in different ways. So you will find people that will show all the symptoms alongside those two.
And just in relation to this case as well, I think her husband's got the symptoms now, so obviously he's self-isolating, but the contacts and family, do they need to self-isolate as well?
They will be if they need to self-isolate, they'll be contacted by public health as part of the traceback.
Second question is we've mentioned 72 hours to get a test and that 13 cases and a number of tests. Is there any work going on to have the testing done to get the results here on the Isle of Man rather than sending away to Manchester, and to speed that whole process up?
There most certainly is. The department has been working on getting a testing centre over here. It's not a quick process, as you would imagine. There's lots to be done in order to design that and get it up and running, and we expect to have our own testing facility on Ireland around about mid-April. Sam, I think you indicated.
For the Education Minister, actually, we had a question sent in to us by a lunchtime assistant at a primary school who wants an assurance that while teachers will be paid, will they still be paid with the children no longer being in school?
What we're trying to do at the moment is look after all our staff. I think that's a very valid concern because obviously people are worrying about their livelihoods as well as their health and the health of the people they serve. We are closing schools, but we're trying to reallocate those staff who can be reallocated, and we will make sure that they're paid for the work they do. We're also reaching out to those staff who work on intermittent contracts and making sure that they're paid as well. At this time, obviously, there's a lot of change, and what we're trying to do is adapt to that change by reallocating various members. Also looking at through the department of people, for instance, at the NSC who aren't working there anymore, bringing them into the schools to support the teachers that are there and support the pupils.
And just secondly, there was a concern about if somebody working in a school has tested positive for coronavirus, what is the policy for informing parents of children at that school?
Yeah, that, again, a very good question and a very valid concern from a lot of parents. Whilst we can't comment on individual cases, what public health are doing is contacting all those people who might be affected. This virus really is spread through relatively close personal contact rather than distant contact. And so they have the ability to actually look at the individual case and contact all those people who may be at risk. But again, may be at risk rather than definitely at risk.
Rob?
Yes, good afternoon. Rob Pritchard, 3FM. First of all, for the Health Minister, with regards, obviously, there are a lot of closures going on the island, schools included. We look at our likes of our pubs, our restaurants, our cafes. For obvious reasons, the supermarkets and pharmacies are remaining open. These are the last places that we're going to see potentially larger numbers gathering. Given the emphasis right now on social distancing, what measures are the government putting in place to enforce and monitor proper social distancing in supermarkets and pharmacies at this time?
Well, we are working with them in relation to the pharmacies, as you would expect. The pharmacies themselves are putting measures in place. They're very much aware of it being by their very nature medically driven. Also in relation to the supermarkets, they've been very engaged as well to try and work with us to get this resolved. I was actually nipped into Marks and Spencer's earlier on. I noticed in the self-service area they've now put tape down on the floor to indicate to people when they're queuing how far they should be from one another. One of the big issues in supermarkets, though, is the general public respecting each other's distance. And with the best will in the world, you can't ask the supermarkets necessarily to do that as people are going around with trolleys. We have got to do that ourselves. As individuals, we have to take responsibility for this. As I put the mantra out yesterday, and this is the line from the Department of Health and Social Care, we need you to help us help you. That is the line, because we can only do so much. And the same with businesses out there, they can try and facilitate things, but we need the general public to abide by these messages and take them on board. That way we can continue to operate the way we are without having to look at more restrictive practices.
Okay, my second question for the Education Minister. There'll be parents out there who are not classed as key workers under those categories. Their children could be at private nurseries, for example, for which you do pay fees for. I just wondered, during this time and under these circumstances, will those parents who are sending their children to private nurseries still have to be paying those fees to keep their children's places at this time?
That's a very good question. What we've been doing over the last couple of days really is trying to reach out to those private nurseries and encourage some of them to stay open. Some of them are obviously concerned about their staff and the children in their care, and obviously work with them to try to provide as much a service as possible for all parents. However, the essence of the message is, if we're going to stop this virus spreading, we need to try to isolate each other. And so those parents who can keep their children at home, keep them at home. Those elderly people or vulnerable people who cannot self-isolate and stay at home, because this is all of us trying to stop this virus causing more damage to our country.
Thank you very much.
Paul?
Can you tell us anything more about these new 8 cases? If it's contact here in the Isle of Man, was it contact from overseas, etc.?
Yeah.
And are any vulnerable? And have you got enough ventilators for this now, which presumably, if you're saying you're predicting this is where we should be, you know that in a week's time it's going to be over 100 or whatever your predictions will show. Are you all that, please?
Yeah, the modelling has been done. In relation to this, I need to emphasise again that all 13 cases are community cases. So what that means is they are self-isolating in the community. They require no hospital treatment. They have not been admitted to Nobles. They do not need treatment in Nobles. They simply self-isolate until the symptoms go away, and that is in relation to all 13 cases. It is across a wide age range. The 13 cases, I can say that. In terms of the breakdown, which I knew someone was going to ask of which ones are being contracted in the community and which ones have travel history, I don't actually have that at the moment because Public Health is still in the process of interviewing and tracing back. But as soon as I do, I will share that with you because I think that's a very important point to make, as I made it yesterday, how many have a travel history and how many developing in the community. But with these cases literally just filtering through, I don't have that information as yet.
Because it affects my next question, is that people aren't taking enough notice. Presumably, if it's been passed one-to-one here on the Isle of Man, the message isn't getting through, and this graph is going to keep going up, right?
Well, the simple fact is the message needs to get through, and again, we are now seeing cases on the Isle of Man, so this should be driving home to people. And as I said, it's across age ranges, this, if you look at the 13 cases, so it's not one particular cohort of people. It is across age ranges, and people need to respect those self-isolation rules and also the social distancing that we've brought in. We haven't done it for the sake of it. It's a clear message, and it's a way to fight this virus. If people don't respect those rules, then like other jurisdictions, eventually we may have to look at firmer measures, and we don't want to go down that line. We want people to be able to move freely around our community as much as possible, given the rules in the current situation. But if we have to look at firmer measures, then we will.
And you'll let us know when you get that information.
And as soon, I'm hoping each day to be able to give you a breakdown between travel and also what is community-based, because I think it's very important to go out. But it's just with the timing of these cases coming in, I just don't have that with me today. Josh?
Thank you, Health Minister. Josh Stokes, ITV. I've had a couple of people approach me with similar questions looking for clarity on self-isolation. A couple of people were saying they were visiting friends, and within 2 days those friends have developed symptoms, and they're wondering whether they should now self-isolate. I'm wondering if you could give some clarity on the time span between visiting people. If they then get the symptoms, what does the individual do?
Well, the virus has, as far as we know, a 14-day incubation period. If they've got concerns, then they should contact the 111 line. That's what it's there for, to be able to try and allay those concerns. People need to make a decision on that. If the friends have tested positive, then obviously they should potentially be self-isolating.
And my second question, we're talking about communication and the message, as you've been saying, and today the police posting again that chasing a lot of reports of people failing to self-isolate. I'm just wondering if the message by the government is still to go to the government website for the information, or is there a strategy now to get the message more out on social media as more of a direct way of addressing the community of the message you're putting across?
We prefer people to still go to the government website for information, for widespread information, because obviously that is where you'll get the true picture of what information's out there. But we are using social media platforms to push out the message, because the message, as I say again, on self-isolation and social distancing has never been more important than it is now. If we are going to stop there being spread in the community, that's how we do it. We can't just do it from community testing and isolation of cases. We actually need the general public to respect these rules. We're looking at short-term disruption to people's lives for long-term gain here. And I think it's very important that people realise that. Ewan?
Yes, just a question on that. There seems to be, and it's not just in the Isle of Man, it's widespread across the world. There is a problem with younger people not taking the social distancing seriously. The police have been reporting about groups of youths gathering together. What powers do you have to make the parents accountable for these children who are clearly not following the rules?
Well, in relation to mass gatherings, the police do have the power to disperse mass gatherings. In their general powers anyway, as far as I'm aware. But in relation to the kids, one of the messages I think we need to get out there is, unfortunately, one of the myths that has developed around this virus is that it only affects old people, with pre-existing conditions. While they are the most vulnerable category, we need to point to the UK yesterday that very tragically recorded a death of an 18-year-old. So it is for their own safety as well that everyone in every age group respects these rules.
Now, I may have missed this, but can you give us the age range now of those that have contracted COVID-19?
I can't give the exact age ranges, but what I can say is it is across a wide spread of age ranges, where I think the lowest case was in their 20s. Alex?
There's been some speculation that the UK is about to enter an increased stage of lockdown and will move towards full lockdown in the coming days. In that event, will the Isle of Man step up its own lockdown procedures? Will it move in line with the UK, in other words?
Everything changes day by day. I think I've said that from day one of these press conferences and when I was doing the individual interviews beforehand. We don't just look at what's going on here in the island, we look at what's going on in our near neighbours as well and the impact that could have. We're not ruling anything out, but at the moment we've just done the border closure yesterday, and that is still the current situation now.
Thank you. And in the event of greater lockdown measures, what efforts will be made to repatriate people from the island who are still stuck in various places around the world?
Well, that would depend upon what measures are underway. If it's a full lockdown, then being blunt, as an island, there's not much we can do to repatriate people. And that's why, again, I would actually make it and emphasise the point that we are saying that people on the island should not be doing any form of travel unless it's absolutely necessary, because this situation is changing day by day and action may have to be taken very swiftly if events change.
Thank you.
Right, well, thank you very much. Sorry. Chris?
Sorry, very quickly, just picking up where Paul left off with the ventilators. Where are we at the moment with the ventilators in terms of the population?
So in terms of ventilators, we have been looking to work with NHS supply chain. We've also very kindly had offers from individuals with companies who believe they can produce ventilators. We are currently working with them to source more. Like I said, the thing I need to stress at the moment is all 13 cases that have been identified are what would fall into the mild category. So there's been no pressure on Nobles yet, but we are forward planning because that situation, of course, could change.
But we're watching almost like a doubling each day. It's following a fairly predictable pattern, so you know at some point that's going to happen, isn't it?
Well, one of the things that's important is it's showing the community testing is working. And one of the reasons we ramped up the community testing is what is crucial is breaking the chain. Rather than letting it run rampant throughout the community and spreading, we can actually get hold of people, self-isolate them and the people they've come into contact with, and that breaks the chain of the virus. And that is why we are doing the community testing that we are. Thank you very much, everyone. Thank you very much, as always, for coming along.